More testing after 70 does not always protect you. Sometimes the very checkup meant to save you is the one that starts the trouble. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share science-backed health tips like this every single day. After years of watching the same pattern happen again and again, one thing becomes clear. Many older adults are not being hurt by a lack of care. They are being hurt by too much of the wrong care. A test leads to another test, then a biopsy, then a scan, then worry, then treatment for something that may never have caused a problem in the first place. Does that sound extreme? It happens more often than you think. Here's the thing. After 70, your body changes, but the way doctors and health systems think about screening does not always change fast enough. Some checkups still make sense, some absolutely save lives, but others may bring more stress, more side effects, and more risk than benefit, especially if you feel fine and have no symptoms. In this video, I'm going to show you 5 health checkups many people over 70 should think twice about and what to do instead. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think more screening always means more safety. It sounds smart, right? Catch everything early, scan more, test more, check more. But health is not like filling your garage with alarms. If every alarm goes off all the time, you stop feeling safe. You feel trapped. A 2020 study from Penn State College of Medicine found that overscreening in older adults was incredibly common. The researchers found that 59.3% of men and 56.2% of women were still getting colorectal screening after the age where benefit becomes less likely. They also found 45.8% of women were still getting cervical screening, and 73% were still getting breast screening past the recommended range. That is a shocking number. Not a few people, a huge chunk of older adults. Look, I'm not saying screening is bad. I'm saying the right test at the wrong time can become the wrong test. That's the part many people never hear. The benefit from screening can take 10 years or more to show up, but the harms, those can happen this week. A false alarm, bleeding, infection, anxiety, a treatment you never needed. So let's walk through the 5 checkups you should not treat like automatic yearly rituals after 70. Number 5, the PSA blood test after 70. Most people think a simple blood test for prostate cancer can only help, but actually this is one of the easiest ways older men get pulled into a chain of testing they never needed. The PSA test is like a smoke alarm that is way too sensitive. It does not only react to dangerous fire, it can also react to steam from the shower, burnt toast, or a tiny spark that would have gone out on its own. A 2023 study from the University of California, San Diego found that low-value PSA screening was still very common in older men. The screening rate was 55.3%. for men ages 70 to 74, 52.1% for men 75 to 79, and 39.4% even for men 80 and older. That matters because national guidance already warns that routine PSA screening after 70 often causes more harm than help in average-risk men. Why? Because the test can find slow-growing prostate cancers that would never bother you in your lifetime. Then comes the biopsy, then fear, then treatment. And treatment is not nothing. It can mean leakage, trouble holding urine, sexual side effects, infection, and weeks or months of stress. The National Cancer Institute also notes that 20% to 70% of men treated after screening can end up with lasting urinary or sexual problems. So ask yourself, if the fire alarm is loud but the house is not burning, do you really want the fire department tearing down your front door? What should you do instead? If you are over 70, feel well, have no urinary red flags, and no strong family history, do not treat PSA like an automatic lab test. Ask your doctor 3 plain questions. First, what happens if this number is high? Second, would treatment help me live longer or just give me more procedures? Third, am I high risk or just being tested out of habit? Those 3 questions can stop a lot of unnecessary trouble. And what should you focus on at home? Not fear, but basics. Aim for 3 ounces of salmon twice a week, about half a cup of cooked tomatoes with a little olive oil a few times a week, and a quarter cup of walnuts for healthy fats. Those foods do not replace medical care, but they support heart and metabolic health, which often matter more for older men than chasing tiny prostate findings. But wait until you see number 4. Number 4, automatic repeat colonoscopy after 75. Most people think colonoscopy is always the gold standard, so the older you get, the more important it becomes. But actually, age changes the math. A colonoscopy is not just a quick peek. It is bowel prep, fluid shifts, sedation, and a camera moving through an older colon. Think of it like sending a plumbing snake through older pipes. Sometimes it is exactly the right tool. Sometimes it creates a problem of its own. The U.S. Preventive Services Task Force says colorectal screening from ages 76 to 85 should be selective, not automatic. Why? Because the possible benefit gets smaller, while the risk of bleeding, perforation, and complications goes up with age. And remember that Penn State study from 2020? It found that more than half of older adults were still getting colorectal screening after the point where benefit was less likely. That tells you how often this becomes a routine reflex instead of a thoughtful decision. So what do you do if your office simply says, "You're due"? Slow the train down. If you had normal colonoscopies before, no new symptoms, and no strong family history, ask whether you really need another one. Ask whether a stool-based test might make more sense. Ask how your heart, kidneys, blood thinners, and overall strength change the risk. Let me be clear. Not everyone over 75 should skip colon screening. Some very healthy adults with longer life expectancy may still benefit. But not everyone needs the full plumbing job every time. Quick question. Have you ever had stomach upset, dizziness, or felt wiped out after a medical test or prep? Comment yes or no below. If your goal is colon health without jumping straight to a procedure, focus on your daily routine. Try to get 25 to 30 grams of fiber across the day. That can look like half a cup of oats in the morning, 1 cup of beans or lentils at lunch, and 1 apple or pear with the skin on. Add water slowly, not all at once. Aim for 6 to 8 glasses across the day unless your doctor limits fluids. And take a 20-minute walk after meals when you can. Not dramatic, but powerful. Your colon likes rhythm, it likes movement, it likes fiber. It does not like being ignored for years and then attacked with a test just because a reminder popped up. But wait until you see number 3. Number 3, Pap smears after 65 when you've had years of normal results. Most people think Pap tests are one of those things you should keep doing forever just to be safe. But actually, if you are over 65, have had adequate normal screening, and are not high risk, routine cervical screening is usually not recommended. This is one of the clearest examples of more is not better. A 2021 study from Columbia University found that nearly 2/3 of average risk women received unnecessary repeat cervical cancer screening in the next 3 years before it was even recommended. That is a lot of extra testing for very little gain. And the reason this matters is simple. A Pap test is not just a swipe and done. An unclear result can lead to another test, then a biopsy, then pain, bleeding, infection, and a week or month of worry. The USPSTF says routine cervical screening should stop after 65 if you have had adequate prior normal screening and are not otherwise high risk. High risk means things like a history of cervical cancer, certain precancer changes, immune system problems, or exposure concerns your doctor has already talked to you about. If none of that applies to you, continuing Pap tests out of habit may not protect you. It may just stir up dust in a room that is already clean. So how do you handle this without feeling careless? Bring your screening history to your next visit. If you do not remember it, ask your clinic to print it. Then ask, have I already met the stop criteria? That one question can change the whole conversation. If they say yes, ask them to document it clearly so you are not chased by automatic reminders next year. And what can you do instead of repeating low-value tests? Focus on symptoms, not ritual. If you have vaginal bleeding after menopause, pelvic pain, unusual discharge, or new urinary discomfort, that is a reason to get checked. But if you feel fine and your history is clean, you do not need to keep poking the bear. For everyday health, keep it simple. Try 1 cup of plain yogurt or kefir if you tolerate dairy, 1 orange or 1 cup of strawberries for vitamin C, and plenty of water through the day. These do not prevent cervical cancer by magic. Nothing works like magic, but they support tissue health, hydration, and general wellness better than unnecessary repeat testing. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, mammograms after 75 without a personal risk review. Most people think breast screening should just continue forever because catching cancer early must always help. But actually, this is where things get very personal. Not political, not emotional, personal. Because at older ages, the chance of overdiagnosis goes up. That means finding a cancer that looks scary on paper but would never have caused symptoms or shortened your life. A 2023 study from Yale School of Medicine followed more than 54,000 older women and found something most people never hear. Among women ages 70 to 74 who kept getting mammograms, about 31% of breast cancers found were likely overdiagnosed. In women 75 to 84, that estimate rose to 47%. In women 85 and older, it rose to 54%. Read that again in your mind. Nearly half, and in the oldest group, more than half, may never have caused harm. That does not mean mammograms are useless. It means they are not one size fits all after 75. The U.S. Preventive Services Task Force says the evidence is not strong enough to make a blanket rule for all women 75 and older, so clinical judgment matters, your health matters, your mobility matters, your values matter. If a tiny cancer were found tomorrow, would you want surgery, radiation, more appointments? Would those steps improve your life or steal peace from it? This is where you slow down and have a real conversation. Ask, if you found something small, would we treat it aggressively or watch it? Ask, what is my personal risk based on family history and past breast problems? Ask, am I screening because it helps me or because I've always done it? That is not giving up. That is wisdom. For daily support, focus on what helps your whole body. 1 cup of broccoli or other cruciferous vegetables most days, half a cup of beans, and 2 tablespoons of ground flaxseed mixed into oatmeal or yogurt can be a smart, low-cost start. Add light strength work 2 or 3 times a week if you are able. Breast health does not live in the breast alone. It lives in your full system. I'd love to hear your story. What made you click on this video today? Share in the comments. Number 1, whole body scan packages when you feel fine. This one may be the biggest trap of all because it feels modern, thorough, and smart. You see the ads, catch everything early, peace of mind, know your body. Sounds amazing, right? But look closer. A whole body CT or MRI scan in a healthy older adult can become a fishing trip in muddy water. The more you look, the more little shadows you find, and many of those shadows mean nothing. A 2023 clinical perspective from the University of Michigan warned that whole-body imaging in low-risk people can do more harm than good. They noted that about 15% to 30% of adult diagnostic imaging finds at least one incidental finding. That means a surprise spot, lump, cyst, or odd shape that was not causing harm and may never cause harm. But once it is found, you do not get peace of mind. You get more scans, more specialist visits, more procedures, more bills, more fear. It is like turning on every light in the attic, basement, garage, and closet, then panicking because you found dust. Healthy, older bodies often have harmless wear and tear, tiny kidney cysts, benign nodules, age-related changes. If you go looking for every wrinkle inside the body, you will find them. The question is not, can we find something? The question is, will finding it help you live better? What should you do instead? If you have no symptoms, skip the executive sounding scan package and put that money into high-value basics. a good blood pressure cuff at home, a medication review once a year, a vision exam, a hearing support if needed, a walking habit, a balance check, real sleep, real food, real movement. Those things are boring and they work. A practical food pattern here is simple. Aim for 25 to 30 grams of protein at meals if your doctor says that fits your kidneys and overall health. That might be 3 to 4 ounces of chicken or fish, 2 eggs with Greek yogurt, or a cup of beans with rice. Add 1 cup of leafy greens and 1 banana or baked potato during the day for potassium if your doctor has not restricted it. That does more for blood pressure, muscle strength, and independence than chasing random shadows on a scan ever will. Let's pump the brakes for a second. I'm not saying this to scare you, but I am saying it to protect you. Never confuse "don't screen automatically" with "ignore symptoms." Those are not the same thing. If you have blood in your stool, new chest pain, a breast lump, unusual bleeding, major weight loss, fainting, worsening shortness of breath, or new severe pain, that is not screening. That is a reason to see a doctor quickly. Also, if you have a strong family history, a past abnormal result, a known genetic risk, or a doctor has already told you that you are high risk, your plan may be completely different, and that is okay. Also remember that some tests become risky because of what happens after them. Blood thinners can raise bleeding risk. Sedation can hit harder in older adults. Kidney problems can make contrast dye more dangerous. Frailty changes recovery. Anxiety changes quality of life. So when a test is offered, do not only ask what could it find, also ask what could it start. That one question can save you from a lot of harm. So you're convinced but thinking, how do I actually do this? Start simple. At your next appointment, bring a 1-page list with your age, your medical conditions, your medicines, your last screening dates, and any symptoms you actually have. Then ask these 3 questions out loud. Do I still benefit from this test at my age? What are the harms for someone like me? Is there a simpler option, or can we wait and watch? Write down the answers. If money is tight, focus on the lowest cost, highest value habits first. Walk 20 to 30 minutes most days if you are able. Eat more fiber from oats, beans, fruit, and vegetables. Get enough protein to protect muscle. Check your blood pressure at home. Review your medicines with a pharmacist. Sleep on a schedule. Those are not flashy, but they keep you upright, independent, and out of trouble. Look, there's a lot of noise out there, more ads, more reminders, more pressure to check everything, but you don't need to overthink this. You do not need every test. You need the right test at the right time for the right reason. Start with just one action step. At your next visit, ask your doctor whether any screening you still do is helping you personally or just happening out of habit. Your body will tell you if it's working. You'll feel calmer, more informed, less pushed around, more in control. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.